Okay, welcome to Oral Systemic Connections, the people and technologies that are leading the medical dental integration. There has been a significant amount of interest in this topic on various Facebook threads that I've been on, electrolytic aqueous ozone. And so on tonight's call, I have Darren Simmons, the CEO of Biosure, and Ken Petersen, who is the sales director for Biosure North America. Let's see. Can you hit the waiting room, Tasha? I think Sue is in there. There's people that are.
Share the screen again with me. Or make me the host again, Tom. I don't think.
Oh, I see. I've got to. Hang on. Hang on just a second here.
We're doing things in a different order, guys. Last time we were recording we were going to try something new.
There we go. That should do it.
Perfect. Yes.
Okay. Very good.
All right. Hang on stand by 1 second.
Okay.
Tom, let me admit everybody.
All right.
Start all over.
All right. There they are. We're letting them in.
There we go. Okay.
Very good. Tonight's topic on oral systemic connections is electrolytic aqueous ozone. I've been on quite a few message board with quite a few questions about this. And so what I'd like to do is to have a Q&A. This is kind of be an overview. Got a lot of experts here tonight. Darren Simmons is the CEO of Biosure. Ken Petersen is the sales director for Biosure North America. And I'm going to tell a little bit of story about how this all came about. Okay, I'm not going to go into very much science. I'm just going to go into the very basics. You can kind of Google ozonated water if you want to take a deep dive. There's lots of information out here, but there are two things that I want people to kind of generally be familiar with if you're not familiar with ozonated water. One of them is the concentration that's measured in parts per million, and the other is half-life, okay? So ozonated water is basically made in two methods. One of them is to bubble ozone gas through water. It takes a little bit of time to do it, and it's also very temperature dependent on the water, meaning that colder water holds ozone longer than warmer water, okay? And it's my understanding that therapeutics levels are at about 1 part per million, okay? So we're going to measure the parts per million.
بعد اون جسی ها رو من باید کلیم بک میکردم
نکردم. Can you mute that?
تازه فهمیدم.
اصلا تو چرا جسی میدی؟ جسی باید بالای اینا 90 تا
اونا از ما کم میکنن.
I'm trying to, sorry.
90 کم ما PlayStation.
Not allowed to.
Okay.
Sorry about that.
Okay, so what happens when water is ozonated is that it creates a compound of 3 oxygen molecules. That compound is very unstable and it wants to revert back to O2 into water. So it's through this process of this third oxygen atom breaking off where you have this highly oxidative process that kills microorganisms of all times. It's a very, very effective oxidating agent, okay? And that's kind of the basics of how ozonated water works. This is October of last year. The ADA had a bulletin about the CDC health alert highlighting the importance of maintaining and monitoring safe dental water lines. Water lines in the dental office are kind of the elephant in the room. You know, it's been an issue for a very, very long time, but there was a cluster of some very serious infections in a particular clinic. And so this was brought to the forefront again in a very timely fashion. So what I want to do is I want to go through the uses of ozonated water in the dental office, and then we're going to go through the devices itself. So what we're talking about with electrolytic ozonated water is on demand, okay? Normally when you make it the old-fashioned way of bubbling it through with a flask, it takes 20 minutes or more. So that's kind of the technological breakthrough that got me very excited when I first learned about this from Sue Ruslan in Australia. So a pre-treatment rinse. To me, this is an interesting topic. I think Dr. Mike Subiak might be on the call tonight, and I'm going to have him tell this story. So about 6 months ago, there was a message board that's on a message board. It said, "Hey, COVID's over. Should we still do the pre-treatment rinse?" And the responses were no, 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 no. And then Mike said, "Why would we stop doing that?" Okay, so the concept of the ADA recommending a hydrogen peroxide pre-treatment rinse was kind of the concept behind it was, hey, we've got viruses and bacteria in the mouth. If we take this rinse right before treatment, we'll kind of knock the bacterial load down. And I would say in the past 90 days, I have never seen more illness in the dental office, meaning, cold, flu, COVID, everything. So why would we stop something? Okay, so obviously there was a cost consideration in using Peroxyl or whatever the product that you were using, but using ozonated water, it's like, no, this is easy peasy. Just dispense the water and use it as a pre-treatment rinse. That standard should probably stay in place on a permanent basis, as far as I'm concerned. Ozonated water at home use. Okay, this was one of the things that I saw in Australia that was really, really a significant thing for me, because being able to generate ozonated water at home safely and quickly. So during the COVID lockdown, and I'll talk about that in a minute, I bought an ozone generators for our offices and for at home. And it's a process. And so the concept of having these tumblers where you can generate it in a couple of minutes at home and use it for irrigation or for any other oral care. Okay, hand sanitation. So one of the things that I'm going to talk about at the end is that we're having a conference March 31st and April 1st. And the clinic that we're having it in is a brand new clinic, and it's ozonated water throughout. Okay, so this is one of the things that's just an absolute no-brainer, is that this is point of care dispensing. The water that comes out of here is ozonated. The only place where it's not is the eye wash station. Okay, individual dental water supply. Okay, so when ozonated water is made, it's put into the bottles. Most chairs today run on a bottle system. It's the safest way to kind of have a contained water source. If your water source is the city water, which would be very unlikely, that is not a very good way to supply your dental chairs. So this would mean everything that comes through the hand water syringe, the Cavitron, the high-speed hand pieces. And one of the things that this made so much sense, and why I was in such a hurry to implement this after COVID hit, was because of the issue of the aerosols. Okay, so especially in hygiene, especially around the Cavitron, there was a lot of concern about what that looked like. Well, in my mind, if the water was ozonated that was in the Cavitron and you were dispensing a disinfected mist, it only made sense that that would take the risk down significantly. Cleaning up the instruments with the ultrasonic, what a no-brainer. Just put some ozonated water in there to use that for the cleaning. The water lines. Now, waterline biofilm management, and I know Darren's going to talk about this a little bit. This is a big deal. Okay, this is both on the supply side, and I'm going to show you a picture on the vacuum side so that you understand this is a different kind of biofilm that Tasha and I regularly talk about. This is a biofilm on the inside of pipes and hoses. Okay, this is a biofilm. This is an old, we have one office that's very old. I want to say probably, 20 or 30 years old. This biofilm came out of a vacuum line. Okay, so what you need to know is that that vacuum hose had disinfectants, a whole variety of disinfectants put down it for literally decades. And after using ozonated water or vacuuming up ozonated water, this sludge, this biofilm, it's almost like a snake skin, began to break down. And eventually one day, one of the assistants pulled this out of and she just had no idea what was happening. But what it did was it left the inside of the hose was pristine once that sludge was removed. Okay. Now it didn't happen immediately, it happened over time. But the important thing is that regular disinfectants did not do anything to that biofilm. Environmental disinfection. So I'm going to talk about that in just a second. What can we do to risk reduction in the dental clinics? And so this was during the COVID breakdown and our lockdown. We were really looking at water and air. I knew those were going to be the two issues. So we came up with this logo that's displayed that we're ultra clean, ultra green. And because I consider ozonated water to be just a complete holistic solution. So this is a traditional way in which ozonated water is made. That's an ozone generator. Beneath the ozone generator is an oxygen tank, and the generator is connected to the tank. The tank is connected to a flask, and there's some kind of a bubbling stone that goes through the water. And like I said, to make a flask full probably takes about 20 minutes. And I would say that as far as like your parts per million, that's going to vary. You know, there's a variety of factors that are going to vary what your concentration is going to be. And your concentration is important because if you put that in the bottles at 8 a.m. in hygiene, you want to be sure that by noon that there is still an effective disinfected concentration at that time. Okay. And I think Darren will probably talk about that just a little bit. So this is the Biosure CDU unit. Okay, this is our new office, and this was the day that we got it hooked up. And boy, everybody was excited about that because they were ready to throw away that flask and everything associated with making water manually. So we're making ozonated water manually. So this is point of dispensing, 6 part per million or 10 part per million. So those are the two choices. And I think if Dr. Subiak's on the call, I can remember he got this recently, and I think Darren, you were involved in a test with him that it was 6 part per million at dispensing, and then at noon it was still 3 parts per million. You tested the water at that time, which is still highly effective as far as a disinfectant. Now this is an inline unit. One of the things that really interested me about this was the use of this in the washer and dryers. Okay. And you know, the concept of having ozonated water and that fresh smell, once you've smelled ozonated water, you'll never forget it. You will recognize it. It is a fresh smell. It's very similar to what the air smells like after a thunderstorm because lightning interacts with rain and makes ozone. So it's something like that. So this is an inline where the water comes through from your source, and then when it comes out, it's ozonated. Now, these are the portable units. On the left is the tumbler, and on the right is the spray disinfectant or the spray bottle. And I think it takes 2 or 3 minutes from my experience. It's a lower concentration than the CDU, but it's still an effective disinfectant agent. Now, on the right here is the environmental misting machine. On the left is what we used during the COVID lockdown. I got one of these from home. I got one of these from my vacation rental. You know, man, I'm going to tell you something. This is pure ozone gas, and you better know what you're doing when you're using this, because you will only walk into a room one time mistakenly with the ozone gas. Now, once again, after it's made, it's a very highly disinfectant. I actually used it as a marketing tool for my vacation rental. We said that after every guest that we had 2 days in between guests, and we had 1 day where we did this gas, right? So just like the water, the gas dissipates, but you do not want to be near this when it's running, okay? Now, this unit is a misting agent, and I'll let Darren talk about the technology behind that. But once again, this can be run in a room in the presence of a person, but the concept is to do surface disinfection with this mist. And there are some videos on the Biosure Dental website that shows how this works. So we've incorporated this in our surgical suites because we want those to run. At the end of the day, we run this, and we want all surfaces absolutely disinfected at the end of the day. So this is one of the webinars that Dr. Subiak and I attended a webinar during COVID. It was really difficult at the time to get information about the dental usage of water. And the websites, the training websites were a mixture of gas and water. And all I was really interested in, I was not interested in taking a deep dive into gas, because using ozone gas in the dental office requires training and expertise, because the gas is more dangerous. And all I was interested in was the water. So we attended this webinar from, I think it was Dr. Maliki. I think he's in Hawaii. And he was talking about, he went over the testing, and he's been doing this a long, long time. And this was conventionally, this was not electrolytic water. It was just conventional, where he sent all these tests to Loma Linda. So they've been doing tests since 2000. I looked on Henry Schein. There are all kinds of different water tests that you can do, but the minimal here is less than 500 colony forming units. And what he was showing test after test was like scores of 0. Okay. And I think on the Biosure Dental website, Dr. Jason Pang, who is someone I've met in Australia, also, he's got all these tests that he did with surface disinfection and different things. Jason Pang has been a real resource for me, because that's where I discovered, I was doing some consulting in Australia with Sue Ruslan, and that's where I discovered Biosure was in Australia. So this is an ATP swab unit, and Darren, I think Darren and Ken both carry this with them. They can swab the surface of your cell phone, and they can show you how contaminated it is, spray it with the Biosure water, and then retest it. It's a very, very compelling test for surfaces. So what I want to do right now is open up for questions before we talk about our meeting. And any questions for Darren in particular? Darren and Ken are with Biosure. Sue?
Initial question was the corrosion. Sue did answer it in the chat, but if you guys could speak to corrosion, that's probably one of the main questions that I get from practices. They worry about how much they can use ozonated water in any type of unit, and they worry about accelerated corrosion. There was another question in the chat about use in mobile dentistry, which I would assume has a lot to do with potential corrosion rates and things like that. So if you guys can speak to that, that would be great.
Sure. Yeah, as Sue mentioned correctly, the corrosion performance around this, or anti-corrosion performance around this, is excellent. When corrosions has typically been associated with the use of ozone, it's from a particular method of producing ozone, which is using air as the source of oxygen to reconstruct the oxygen molecule into an ozone molecule, which is 3 atoms of oxygen in that molecule. The process of doing that, air has 78% nitrogen in it. So when it goes through this process, it's also oxidizing nitrogen at 4 times the rate of ozone or oxygen molecules to create ozone. So you're getting a lot of bad byproducts in the form of nitrogen oxides, which is the gas that comes out of the tailpipe of cars. It's noxious and carcinogenic. It's also has nitric acid and nitrous acid. So it drops the pH of the water when it gets dissolved into when ozone gets dissolved into water with these gases, drops the pH, and that's what helps it become more corrosive, as well as with the acids that are being produced with nitrogen. That also works for those same air units that Tom was describing earlier in the slide. I think probably anyone that's familiar or had experience previously with ozone, that's probably the most popular device that's on the market today for sanitizing a room. Again, producing a considerable amount of nitrogen species along with the ozone that's being produced. So that is very noxious. It's a very tough odor to deal with, and you shouldn't be around it at all when that's when that's operating. Our system, and what sets us apart from systems that are in use today, is that we source oxygen from water. So we're actually reconstructing the water molecule, breaking it apart through electrolysis and harvesting the oxygen from those water molecules, and recombining them into an ozone molecule. Through this process, we produce the highest purity of ozone available in the market that then gets dissolved into water for use in application, or in the case of the small room sanitizer, is producing a high purity stream of ozone. It's pH neutral, so we just don't have the issues with corrosion, but there's also a purity and a safety that's associated with the with ozone that we produce that's really superior to anything else that's available on the market. And it also reduces the complexity of producing and delivering or administering the ozone.
Awesome.
I think the second question real quick about mobile dentistry, this is actually an excellent application for mobile dentistry. Unless you're carrying bottled water, it's distilled, and I'll talk to that in just a second. It's typically being held in a holding tank or a storage tank, which harbors or can harbor bacteria and form biofilm over periods of time. One popular application for our equipment today is in the use of recreational vehicles, where they actually recirculate or the water in those holding tanks through our system to dose it with ozone to prevent biofilm from forming, as well as deodorizing the water at the same time. So it actually brings a higher level of assurance that your water quality is very good. It also, if you run it at high enough levels, will produce a concentration that's a very good disinfectant. All of the products that we're talking about today deliver an aqueous ozone solution that performs equivalent to hospital grade disinfectant. So we consistently see 5-log or 99.999% or better reduction of contaminants like MRSA, Pseudomonas aeruginosa, Staphylococcus aureus, Legionella, Salmonella, etc., within seconds. 15 to 20 seconds is easily achievable. And some of these I've mentioned are antibiotic resistant or resistant to other chemical disinfectants that take upwards of 5, 10, 15 minutes to actually be effective, if they can be. What's unique about ozone is just difficult impossible for bacteria and viruses to develop a resistance. So for mobile application, it's great. You don't need to worry about the corrosion performance. You don't need to worry about, I don't really know if I understand how can we protect the residents, but there's not a harmful element of this to be worried about. We can talk to a number of different applications in society today, like bottled water. 90% of bottled water in the U.S., North America, is processed with ozone. So the ozone's used to disinfect the bottles or the package that it goes into. It's used in the actual disinfection process of the water, and also the surface cleaning for the equipment that packages it. And it's so nice because it does its job, knocks out the contaminants that are present, and then reverts to oxygen. So it's very safe and very neutral to the packaging and other materials.
Darren, we have another question about actual implementation, more the buying questions that every doctor is going to have to implement in their practice. And they're wondering about just the costs and the processes for a practice. How do you connect it? So this might be a good question so if an office wants to utilize ozonated water, and they have the bottles that are hooked to their chair, let's say. So if they're just going to, have it from the tap, what's the process? How easy is that? A general cost, rough estimate. Obviously, every practice is going to be different in what they need, but how long does it take? What can you share with us about that?
Sure. So the system that Tom showed that was just being installed, the Biosure, we call it the CDU, the Central Disinfection Unit. It plumbs into a water line. You can pre-filter it at varying levels. We have some recommendations, but we have a minimum requirement. It connects to a drain, and then it plugs in. And then you have 10 parts per million of ozone on demand. And just to give you an idea, our testing has demonstrated through third-party certified labs that 3.7 parts per million will destroy, completely eliminate a sample of MRSA well beyond 5 logs reduction. So extremely effective. And now we're producing a concentration of ozonated water at 10 parts per million that is more than powerful enough to do the job on those kind of contaminants, but also safe enough to come into contact with. It actually is very nice for skin contact, as well as if you ingest it, there's no action that needs to be taken. It's completely safe. The SDS sheet reads just like water. So I think it's important to understand that you have a very powerful disinfectant, and at the same time is very safe, that is on demand with just water and electricity as the input sources for it. There's no other chemicals added, no other additives are put into the system to help it achieve this level of performance. It's just strictly modifying water into an oxygen molecule, an ozone molecule of oxygen to make this happen. So that system, for instance, on our website right now, it's listed at $4,450. We will have to raise prices later on in the year to kind of recover from some of the impacts that we've seen in the market, just the cost to deliver and bring into the U.S. But if you think about what you can replace with that, then each office can go through and do a cost-benefit analysis. One analysis has demonstrated up to $60,000 savings in the practice, both through a combination of chemical savings as well as labor savings. Now, you only realize the labor savings if you reduce your head count accordingly. But what we recommend is repurposing, that portion of your staff to higher order or higher quality activities that just help improve the quality and the operation of the practice. So everyone has to really basically do an analysis on their own practice. But some of the things that you can start to substitute or supplement or even replace would be surface disinfectants. It's very friendly to materials in the operatory, so upholsteries, hard surfaces, etc. The FDA has approved ozone as a surface disinfectant, hard surface disinfectant for food and beverage contact as an example. Hand washing, we've demonstrated consistently 5 log or greater reduction of E. coli on hand washing within 15 seconds, just to give you an idea how fast and how powerful it can act. And that's after it had been contaminated with 4.2 million colony forming units of E. coli. So very effective from that standpoint. Oral hygiene, rinsing, Tom spoke to that earlier. I think everybody can start to get an idea of how powerful this could be and what they could do with it. Certainly up to each practitioner to figure out how they want to use it that way. Dental water lines is really the sweet spot and the impact that it would have on a practice. So the FDA regulates dental equipment and dental operative devices as class 1 or class 2 medical devices, depending on which ones they are, which means that a system has to be FDA approved or cleared for marketing and claims. So what I can do is share with you where we're at in that process and experience that we've had so that everyone can make a decision about how they want to implement it themselves. So it's other systems have been previously approved. They're no longer on the market for other commercial reasons, not regulatory reasons, but they have been approved by the FDA for use in dental water lines. We have over 3,000 systems in service in Taiwan, and conducted a study by a third party called SGS, which is a Swiss organization that's used throughout the world for these type of validation tests. And we tested 50 random samples of 50 different dental practices in Taiwan before and after, and they ranged with colony forming unit results of anywhere from 50,000 to 910,000 CFUs per ml. So heavily contaminated with bacteria. After treatment of 2 weeks with our system, which goes through and provides an initial shock, and then ultimately a reduction, elimination, and prevention of biofilm from forming, consistently achieve 0 CFUs per ml in each of the systems, in all 50. And that's important. Certainly it's important for the practitioner, the staff, and then if you're dispensing an active level of ozone, then you've got just an added layer of protection in terms of what's happening in the environment as water leaves the devices. But what's important to recognize, especially if you're using distilled water in your bottles, if you're not adding something to it, then there's no residual disinfection properties in the water to prevent cross-contamination from occurring and ultimately biofilm forming in that system. And the same holds for water that's being dispensed out of any filtration system that includes a carbon filter. So you may not be using distilled water, you may just be using a high quality purification or filtration system. If it includes a carbon filter, that carbon filter removes chlorine from the water and also eliminates its residual disinfection properties. So now you have water that's exposed and could potentially, harbor bacteria and grow it. So that we have the equipment. You can make the decision to use it and implement it. We have plenty of studies and information in the market about how it works. We're going through that FDA approval and expect to have it completed by the end of the year.
Very good.
We had another question, Darren, in the chat. It's from an Australian somebody listening in. And so you may or may not know this, but it's it says, is the brand TGA or TGA listed or ARTG listed? What they're asking is, the dental chair is classed as a medical device, so we have to use TGA approved products for our cleaning steps. I'm very keen to use ozone, but want to ensure that we're within the Australian regulations. Sue may want to chime in here if there's somebody else on the call, since US and Australia is not necessarily the same regulations.
Happy to chime in. We've also got Michael Wong, who's just answered the question in the chat as well. So really fortunately, I came across ozone 20 years ago and I really was excited by it, but then it seemed to just disappear or disappear from my consciousness. So it was really exciting when Paul Boutis from Medical Innovations in Australia brought it to our attention again, and all the products are absolutely unbelievable. And it's how I introduced Tom to the products and how we met Darren. So we've got the two types of products. We've got the ones that we use in our dental practices to clear our lines and disinfect our rooms, etc. And then we've got the amazing products that we actually have for home care. You can't go to the shop and just buy ozonated water in a bottle. And that's where my passion is, because I work really heavily with, as a trainer of dental hygienists, and home care is where my passion lies. But I work very closely with Michael Wong, who is, Michael, do you want to just introduce yourself? But my understanding is you're working at the moment with the TGA, which is the Therapeutic Goods Administration, similar to the FDA in the US.
Hi, my name is Michael, and I'm the representative of Australia Biosure, looking after this region here. And very fortunate, I've had the opportunity to work with Sue, and it's through Sue that I get to recognize the network of the Larkin protocol. Because of a recent event, one of our distributors has recently passed away. So there has been some hiccup in terms of getting the TGA and listing of ARTG approval. But we have appointed a new agent in order to get us back on track, so that this system in the process of being reviewed. The documentation has been accepted and is with the body currently. So we're expecting this to get through later this year, but I just can't give a firm date because this sort of have recently changed in the process of where we're going, that's all.
Yeah.
And just to add to it, I don't know, I'm not familiar enough with that particular regulatory body in Australia, but in the US with the FDA, they typically, there's a process called 510K, predicate device approval. And that's what we're, that's the final step for us. And what that does is it allows us to market and sell the system and make claims about what it'll do in the device or in the chair. So, until we have that, we can reference studies, we can share with you, what it'll do, but it's ultimately the decision of the practitioner to decide to use it that way. And they have the latitude and the flexibility to make those decisions. The good news is ozone's well understood by the FDA, the EPA, the USDA. They all use it. They use it in their facilities for various applications. We have NSF approval on devices. for disinfection, which is unique, and we're one of the few manufacturers of ozone generating devices that can do that. So it's well recognized. I think the breakthrough for us, and what the advantage is going to give to all of you on the call and your the field, is the ability to simply and elegantly produce your own high-grade disinfectant in the office with virtually an unlimited supply, at your convenience. You can control how you use it, from surface disinfection all the way to other applications. And certainly you'll research and understand how it works. So wide range of products that it can displace. It's completely green and natural. So from a sustainability standpoint, you're not getting exposed to harmful chemicals. You're not exposing your staff and patients to harmful chemicals. You're reducing or eliminating the waste that comes with the packaging on disinfectants and other products that are being delivered. The spray bottle, for instance, that Dr. Larkin had on the slide earlier, we guarantee that those devices will generate 2,500 uses of aqueous ozone. You fill it up with tap water, has a rechargeable battery, you activate it, it produces 3 parts per million of ozone. That 3 parts per million is going to act as and perform equivalent to a hospital grade disinfectant. And you can do it 2,500 times. So from that standpoint, it's 50 times more powerful than Lysol or a chlorine-based chemical disinfectant. Works 3,000 times faster on the bacteria or virus, chemicals. It neutralizes a lot of chemicals in a much superior way. But you're replacing ultimately 2,500 cans of Lysol. Now we tell people we don't expect anyone to use 2,500 cans of Lysol in their lifetime, but just giving you some idea of what its range and application and the leverage that you can get out of it in terms of redefining your infection control procedures and your footprint in an office is significant. It's impossible to overstate the positive impact you can have with this.
Darren, could you answer a couple just more basic questions for novice like myself? So there was one question in the chat about safety with swallowing and just using if that's all okay. And then could you also talk a little bit more about the working time? So from the time that you pull it from the spigot to then using it, what's the working time and how much contact do you need? So like when you actually use it, so if I was going to use it as a hygienist in my Cavitron, let's say, and I'm irrigating a patient's mouth, like how fast is that working time and how long is that ozonated water good in my bottle? What's the half-life? So that whole process.
Great question. So from a safety standpoint, products like this, chemicals, all have what's called a safety data sheet. I'm sure everyone's familiar with it. OSHA in the US requires that you keep these on site and available. Our SDS sheet reads just like water. If you skin contact, eye contact, ingestion, anything like that, you take the same action that you would take as if you had the same contact or interaction with water. So from that standpoint, it's no problem. When I was first introduced to this, we wondered a little bit about drinking it. Would that be a problem? Would it upset the biome or the natural flora in your gut and things like this? And we work closely with a periodontist who's also a licensed nutritionist, and she believes there's a lot of benefits to it. And what it seems that happens is, and this kind of starts to roll in now to the longevity or the active period for it. So as Tasha mentioned in the question that was asked, ozone's very reactive, right? It has a third oxygen atom that's desperately trying to leave the two that are have a strong double bond. So if it comes into contact with another ozone molecule, they'll quickly recombine into 3 oxygen O2 molecules, just like the O2 that we breathe. So it's constant, it's a race to use it while it's still, the concentration's still high and it's effective, because ultimately when left on its own, these ozone molecules will just recombine and break down to regular oxygen molecules and won't be reactive. So pH is a significant factor, one significant factor, as well as heat and how fast that breaks down. So a lower pH and a higher heat will accelerate the breakdown of ozone into oxygen. So, you know, when you hit it, when ozonated water hits the stomach, the acid in the stomach knocks it out pretty quick. So I don't think it goes beyond that. In any significant concentration, you just be dealing with oxygen and any reaction that oxygen would have with the acids and anything else. It'd just be like drinking oxygenated water at that point. The going to the half-life now, 1.5 ppm, we like to draw that as a line for disinfection. So if you're really wanting to use ozonated water as a disinfectant, you need to factor in that you want to be at 1.5 ppm or higher. And I think it's important to mention that, you know, a lot of systems will say that they're 1.5 ppm or 5 ppm, et cetera. Our technology and the way that we produce water, 1.5 ppm, I've found is equivalent to what others will advertise as being 3 to 5 ppm if they advertise it, right? Just because the efficiency and the actual quality and the way they measure it isn't accurate. So yeah, if you're looking at other products, I encourage you to look at their advertised parts per million or concentration of dissolved ozone. And if they don't advertise it, that's a red flag. You need to stop, and you really need to start asking some questions about the quality and the suitability of what they're producing. But if we just draw a line at 1.5 ppm, if you start with 10 ppm, typically in an average office with the temperature and you know you're going to be in a neutral, acid neutral environment, you're probably going to be about 25 to 30 minute half-life. So every 25 to 30 minutes, that concentration is going to reduce by half. So first 30 minutes, it's 5 ppm. Second 30 minutes is 2.5 ppm, and then 1.25, et cetera. So yeah, I've seen some practices fill water bottles up at the beginning of the day, and they use it for the first couple of hours. It's active, and then after that, it's just purified water. But it's already knocked down the bacterial load, if there was any, to a safe level, and which doesn't give it time to basically recolonize before the next day when they treat it again. I've seen some practices that replace it every hour between patients so that because they want active ozone available, right? So they're happy to run with 10 ppm to say 8 ppm for patients. And so, yeah, I think that becomes, you know, a little bit more of a personal choice from the practitioner and the patient that they're working with and what they want to do. So, yeah, from that, and when it gets into that, we say, we let you know that we're producing a high quality ozonated water from water. It's clean and pure, it's safe. You know, you're now dealing with an individual situation that you really should be making the decision yourself about how you want to use it. And what you'll find is that it's very forgiving in terms of making sure that it knocks out anything that's there, but you can't. It's very difficult to overuse it. And yeah, we get a lot of it's kind of funny. We get a lot of requests for help in practices where a doctor or a hygienist has just made the decision that they want to use it, and then they take it to their staff, and their staff has a hard time. Yeah, it could be other hygienists, other dentists, assistants, managers, et cetera. They're trying to understand this, right? Because it is a little bit hard to someone that's not very advanced with their understanding of science, that you could take water, electricity, cleave a water molecule, dissociate hydrogen and oxygen, activate it with a very specialized catalyst that nobody else can produce, like PES can, and generate this molecule of ozone that's then dissolved in water and delivered as a hospital grade disinfectant. I mean, it just seems a little unreal. And what I like to do is, a couple of things to kind of bring it home and let people associate it with, common understanding. First of all, you smell it. The best thing to do is associate it with a lightning storm, right? So your lightning goes through the air, generates ozone. you smell it. So it's a very familiar and recognizable odor or scent that way. The second, and I think I found this one to be a kind of a clever way to understand it, is really what we're doing is we're taking water, we're putting electricity into it, and we found a very clever way of storing that electrical energy in a molecule called ozone that's in the water. So we have this water that's positively charged, and when it comes into contact with bacteria, viruses, or chemicals, it electrocutes them, and they can't stop it, right? But that electricity or that electrical charge is in millivolts. We as a person can't feel it or sense it whatsoever, but it's absolutely lethal when it comes to bacteria or viruses. And that, in the probably simplest sense or layman's terms, is what's happening with this water. And that we find that really helps people get over the hurdle of understanding.
Darren, can I just ask a question? You got a wonderful way of explaining that, so thank you. So,
You know how many times I've practiced that?
I don't know, you just did it perfect. So snapshot is awesome.
Thank you.
But so I've got a little flask. We've got the dental chair, and I know I don't want to railroad Tom's wonderful lecture because he's talking about the dental chair, and that's kind of freaky, right? What's going on inside that dirty secret inside those tubes. And then we've got the home products, which I've already fessed up is my area of passion. I've got a little flask sitting next to my bathroom sink, and after I brush, floss, tongue scrape, everything, I just press the button, and I've got ozone within 3 minutes. And it just the contact time is like 10 seconds or something to be bactericidal, virucidal, and fungicidal. And then the second question, because once you get on a roll, is the squirty bottles that we've actually got coming out to actually use for surface decontamination. Can you just mention those two things?
Sure. So I think what's important, you asked, you mentioned the point about the contact time and how fast it takes to fill it, right? So, the great news, I mean, I guess one of the positive things, if we can start to enumerate them from COVID, is that everyone has a much better understanding of what disinfection is and how to do it: cleaning, disinfection, sanitizing. And so, we refer to the susceptibility of any kind of disinfectant, and in this case, ozone, of a bacterial organism, a virus particle, or yeast, mold, fungus, chemicals, because it neutralizes quite a few chemicals. So we talk about the susceptibility. So what's nice, like if we use MRSA, right? So MRSA is a bad one. We all know what that one is. And in less than 15 seconds. So we started with, I think, in a particular test of 500,000 CFUs per ml in a suspension, treated it with 3.7 parts per million of ozone, 99.999% kill in 15 seconds. Then at 20 seconds, it was no longer detected, as a viable living organism, right? So that's a susceptibility, right? So in any kind of contaminant, it's important to really understand how fast or how long it takes for any kind of disinfectant, a chemical or ozone, to be effective in killing it. Now, when you come to the practical application of it, you really need to understand and assess what your burden, your bio burden is, your load, and then what volume and concentration of ozone is required to treat it, and then what the contact time has to be. Because there still needs to be some time given for diffusion of ozone in water to go through the medium or the film that contains those contaminants that you're trying to destroy, right? You need to make sure you have enough of the ozone to effectively treat however much burden you have, right? So that can, that is a time component or variable that needs to be considered and understood. That's really why we overshoot and go to the 10 ppm, is to really help it be forgiving in an environment. That you're coming in with probably a 3 to 5 times factor of safety in applying it and using it in a situation. Now, the biofilm snake that Dr. Larkin showed coming out of the tube, I mean, that's a huge burden, right? So really what happened there is ozone started working on it and breaking down biofilm, And biofilm in itself is an entirely different body of science. It goes far beyond just killing bacteria. But it started to break it up and loosen it so that its adhesion and rejection from any other living parts of the biofilm, started to occur. And then the suction force pulled it on out. So it broke it loose, right? And I think it clogged up the vacuum line, and that's how they actually discovered it. So, but that probably took a few weeks, maybe even a month or two for that to happen, right? So you really need to assess it. And that's why it's important to clean. If you clean first and then disinfect with ozone, you're going to achieve a superior result, right? If you don't clean and you treat it with ozone, it's going to take some time. It'll break it down, but it'll take some time. I could probably show you guys one of the best illustrations on that we have on an ice machine, where we just let it break down over about a 2-month period, and how it went from a very slimy, contaminated, dirty ice machine to absolutely pristine, as if it was brand new out of the box. But it took 2 months to do it. But that was without somebody going in and physically cleaning it and removing it.
The uses are just endless. I feel like somewhere along the way, I think Michael Wong gave me a little purse-sized sample sprayer. I guess you've got them. I probably shouldn't talk about them because I don't think they're on the market yet, but that sits in my handbag. And I've just been to Bali for a month, and the people I were with were doing all sorts of stupid things, cutting their feet on coral and falling off motorbikes and all sorts of things. And it was always Susie to the rescue. All my family now know. They go, "Where's the ozone?" And so and even hand sterilizing. I don't really like lathering myself in that aqueum and all the the products that you've got to soak in. So spray it on your face in the morning. I love it. It's amazing.
My brother,
Dr. Hale last week or 2 weeks ago, Tom, Dr. Hale was talking about how her son is a wrestler, and he got, what was it from the wrestling mats?
staph, would have been staph.
Some kind of fungus or something from the wrestling mats. Doctors couldn't get it treated. She just finally used her ozonated sprayer that she got from you, Darren, at one of our events, and took it away within the next day. She said it was nearly gone. What I love about it too is Dr. Pang, I had reached out to him via email, and what he had said, Sue, well, everyone, but was one of the things that he really liked was just like it kept the water lines clean. Even if you're not even using it for that and you're using it for active treatments, like he uses it in his EMS machines. He just uses it for all of his patients. You would know better than me, Sue, since you work with him, but he was just saying like, it's like a side effect. It just keeps everything so clean and it's great for patients. It's like, there's not a lose situation with it.
But it's not a chemical. We haven't got chlorhexidine, and we're not bombing the whole microbiome. Sorry, Darren, if you're probably better to explain this, but my understanding is that it works on the anaerobic bacteria and not the aerobic bacteria because of the oxygen component.
A much faster rate, and the aerobic bacteria will restore faster than the anaerobic. So that's another question that comes up often is what happens with just the balance of the bacteria in the mouth by using this. Does it throw it out of balance? And consistently, we see that's not the case. My father's on the call, Wayne Simmons. He's a prosthodontist out of San Antonio and practiced 45 years, an expert in implants, and he uses one of the marketed systems for assessing the bacterial contaminants, the pathogenic bacteria strains or species that show up in the mouth quite frequently. He did a test between with two patients before and after, with one starting with 24 hours no brushing, and then took a sample, and then came back after I think 60 seconds of brushing with ozone only, no toothpaste, just with ozone. Did a before and after, and that was with the tumbler that you're talking about, Sue. That's just the portable device, and across the board had a 36% reduction in the bacterial load of the 11 that they specifically target and look for. And in one of the cases, I think 2 or 3 of them were above the pathogenic threshold, and they had been brought back down underneath the under the threshold. And so, Dr. Larkin and most, if not all of you, are using the microscope, for assessing, biofilm. Dr. Payne has a beautiful video out there that shows the before and after that really demonstrates how powerful it is and kind of maintains the I guess the proper bacterial profile in the mouth.
I love it. I just wish every office had it.
Tasha, there's a question about surgery. I think it says,
Oh, I missed that. Okay, how does introducing ozonated water irrigant used in a dental surgery impact healing? So how does ozonated water impact the healing for dental surgery?
So, maybe Dr. Larkin's better at answering this than I am. One thing I would recommend everyone doing is Googling or doing a search on MRSA wound and ozone treatment, and you'll get some pretty good before and afters and some great explanations about what ozone does or can do to wounds. And I think then you can start to draw a correlation or parallel to how you would practice with it. At the end of the day, I'm an engineer, so I grew up in a family of dentists, and maybe at times I'm a frustrated dentist, but I'm still an engineer. I'm probably not fully qualified to answer that question.
so can Dr. Subiak, can he jump on here? Mike, if you're listening.
He's on here. There you go.
I can,
Unmute.
yeah.
Okay,
Yeah.
so you just got Darren was in California, and you got to meet Darren and get your unit, what, 2 months ago?
Yeah, I bought it and it was sitting in my office, just hanging out in the box. And Darren's calling me up going, I don't get it. Why aren't you using it? Why isn't it hooked up? And I'm like, well, it takes time and all that sort of stuff. I'm going to, I'll get there. He's like, I'm coming by. So Sunday night, I look over and Darren's underneath my sink hooking this sucker up. And oh my God, what a difference. I mean, to go through from doing, hypochlorous acid that totally corroded everything to bubbling water, which my team did. And they accepted that pretty well. But to now have that CDU and be able to just fill up a bottle. So we use it. And I'll tell you, it's been almost 3 years that we've been using ozonated water, and there's been no corrosion whatsoever. But we have our patients pre-rinse with it. It's it's in all of our bottles, so it's going through the EMS guided biofilm units, our piezos, our cavitrons. It's going through the drills. It's going through everything. It's just been absolutely phenomenal. But Darren's like, okay, I hook yours up, but you got to tell me, why are dentists so lame? No, he didn't actually say it like that, but it kind of is like, what does it take to get this sucker? And it's like, well, we're busy. And he's like, you saw how long it took me to hook that up. I'm like, yeah, I saw that. That's really embarrassing. So anyway, yeah, I'm an idiot. It's the best thing ever. I hate to just be, it's so cool. And to be able to have it on demand and just constantly be just replacing our bottles. And I don't mean constantly, because it really, we get hours and hours and hours of use out of it because it has such a high concentration. So I just love it. And I have a tumbler that I use to make ozonated water to put in my water pick, which I absolutely love. Yeah, there it is. My brother had a periodontal abscess. And so I gave him a tumbler, but I said, I'm only going to give this to you if you're going to use it, because, otherwise I'll give it to someone who cares. And he's like, yeah, I don't know. I'm using it and like all this brown stuff's coming out of my mouth. I'm like, yeah, that's why. He basically had one of those snakes in his mouth. But when we first started using ozonated water, I think I replaced the trap on my vacuum 16 or 17 times. And so it really is amazing what's going through our lines. And even, you start using it and you see through your drill, you'll see little black spotty stuff. And I was using Steri straws and doing, our bottle system and all that. I can't believe how much stuff was actually in there. It's kind of gross. You aren't recording this, are you? Anyway, I am the biggest. Biosure is like, it's so easy to use. And my patients, when they pre-rinse with ozonated water, it just says, hey, you guys care. You guys are on top of things. So we do like the worst dentistry on earth, but they think we're really good because they're pre-rinsing with ozonated water. So it's pretty cool.
So
Oh.
Mike, were you on the call early when I mentioned you in that thread about 6 months ago about the pre-rinsing? He goes, now that the pandemic's over, are you still doing the pre-rinse? And everybody's like, no, no, no. And then you got in there and goes, what the heck? Why would we stop?
Yeah, it's kind of like after the AIDS epidemic stopped, we took off our masks and gloves and we don't use those anymore, right?
Yeah.
It's like, no, of course, we've upped our game. And I think, Tom, you and I both kind of used the opportunity to really look at what is a sustainable, what will we really get out of this pandemic? And really, air quality and water quality are easy things to deal with. And if you love your team, since they're breathing and swimming in this world of aerosols, it's really a nice way also to tell our team that we love them and that we're willing to take those measures. So it's been really well adopted by my whole team. It's not one of those things that's sitting around doing nothing. It's in use today.
Yeah,
Hey, Darren,
yes.
Quick question. You had mentioned something, you had done a cost analysis, because obviously Cavicide is like incredibly expensive. Do you have some studies that you've done around like, the average office replacing, Cavicide and this, that, and the other?
Yeah, it's this one in particular was in Charleston, South Carolina. I think had 12 ops, run at least 4 or 5 hygienists, and it was a pretty busy practice. They had pretty frequent turnover. So the 2 main things that they did were they switched to aqueous ozone for all their surface disinfection, right? And they have a CDU, so they're treating it 10 parts per million.
Okay.
And then also changed out their water bottles, so they stopped buying the steri straws or the tablets or any of that. And then they dropped their turn time from like 10 minutes to, I think it was 2. Because now you don't have to wait the 10 minutes for the disinfectant to be effective. I mean, you want to spray it, wipe it, and you're in about 10 or 15 seconds in that process on the surface, and you've disinfected it, or it's been disinfected. So their chemical savings, across those operatories was calculated. I don't have the data right in front of me.
Okay.
I want to say that was between $5,000 and $10,000 a year, something like that. Okay. And then another 50,000 or so just in the labor savings, and then of course the increased productivity of the chair. So I mean, if you're tight on chair time and you want to turn them over quickly, then you're going to get a higher absorption in that overhead and get a better result from just productivity and efficiency financially. But then you can free up your staff to do other things that are hopefully more important and improve the overall quality of the practice. So it's from a production and process standpoint, it's kind of dangerous to say, hey, buy this and you're going to save $60,000.
Right.
You're only going to save it if you fire somebody, right? But
well, can I poke holes in that, Darren? Because
sure.
On the practical scene in a dental practice, the end of the day becomes this whole sort of flurry of energy where everyone's running around sterilizing all the units, and it can take a good 15 to 20 minutes. So is what they're suggesting that time is actually shortened? And honestly, in Australia, that's when all the overtime is paid. So money goes flying out the door at time and a half or double time because everyone's holding back to kind of get this chair sterilized. Is that maybe where they're coming up with that? Because I would love to, at the end of the day, run a system through our chairs that was a 3-minute process and not a 10 to 15-minute process.
Sure. I mean, it's just, every practice, every practice is very individual. There's very few that are identical, right? So that's why I try to be a little hesitant and cautious. We can replace chemicals, right? So that's a hard savings right off the bat. And that's what I like to hang my hat on. Then if you have labor savings, I came out of the manufacturing environment, so really, think of a dental practice as a manufacturing facility, right? I mean, a good one that's running should be a manufacturing facility, or be treated one. It can at least be modeled as one. So then when you're looking at labor savings and you're looking at efficiencies and things like this, it comes down to, are you able to save time? Are you able to free up people to do other things? Are you able to, between patients, reduce the downtime of the chair? Can you squeeze in another patient, during that time because you've now freed up the chair? That only matters if you have 8 chairs and they're always full, right? If you have 8 chairs and at any given time 2 are empty, then it's not going to make a difference, right? It won't impact that particular practice. So that's why that's a very
you're just shortening the time that disinfectant's sitting on there if you didn't have ozonated water. I mean, if you got 5 chairs and you got 6 patients waiting, you're going to shorten that time, and that disinfecting time is going to go short. And I think, I don't know about Australia, but in the States, that's what I see is happening, is like, it's probably dry, but no, it's not dry. And so there can be a lot of different wiggle room. So I see a whole lot of benefits for a shorter disinfecting time for patient safety and for efficacy and the whole thing. I think that's really great. We did have one more question from Dave in the chat about, in the case of the machine that connects to the main water line, do you have to run water? Like, so when you come back from the weekend, how long do you have to run water through the units to disinfect and clean everything? Like if they've been, so if your units are sitting over a 3-day weekend and you're starting everything up again, how long do you need to run that ozonated water through to feel like you're clean? It sounds like to me, depending on how long you've been using the ozonated water, you're always loosening some of that stuff. So maybe that's a load.
So after a couple of weeks, like we showed earlier, I mean, you get to 0 CFUs, you have no biofilm in the system, right? So 3 days, what you have at the end of 3 days is really going to be, if there was bacteria that had, cross-contaminated the lines and gotten back into it, and then had the opportunity to reproduce, right? So they have to have nutrients and the ability to reproduce. So it takes some time for biofilm to develop. You're not going to have an issue. So I would say none. Now consistently, the dental offices that we work with that use it in their dental water lines, they they're just like any others. They work, some only work 3 or 4 days a week, and they run all the time, nothing special. They just fill up bottles when they need water and they use it, and they test regularly. I mean, some send it off to Loma Linda, some do quick pass tests, and 0 CFUs consistently. So you've knocked down you've eliminated, you're using it frequently enough, you've eliminated the bacteria in the lines, and you've significantly reduced or prevented the ability for any bacteria to develop and reproduce and form a biofilm. It's certainly not going to form a biofilm within 3 days. There may be some free bacteria in the lines, but they're going to be destroyed as soon as you flush water through it, ozonated water through it.
Darren, do you have an FAQ sheet of this and like some YouTube videos of installing these units and just kind of the bullet points of what we've discussed tonight?
Yes, there's quite a bit of information at dentalozonwater.com, and then there's a lot at biosureozone.com. And then even besgroups.com gets a little bit more into the core technology and in the manufacturing. I would say we're a lot of information there on efficacy, so you can look at different organisms. We're certainly happy to provide any information or data that people want to better understand it. We're very proud of our manufacturing and BES groups who has developed this technology. It's been a labor of love on their behalf and perseverance over the last 37 years to get this technology where it is today. For us, it seems like it's a breakthrough, but it's something that that's evolved over the last 37 years. And this particular group that founded this company started a company 50 years ago that is an enormous contract manufacturer for appliance companies like Shark, Hamilton Beach, Cuisinart, KitchenAid, etc. So they have a heritage and a background in building many appliances that we use. So it's just an extremely high quality manufacturer. Just a rock solid technology, high quality, just a very elegant and simple use, a simple way to use it. So a lot of information we can provide. It's easy to, as you get to know it, and we like this, right? So it's we welcome and invite the dialogue. We try not to overwhelm people at first when they get introduced, because you can really go down into some serious detail pretty quick. So we'd like to try and keep it fairly, simple and easy to understand. But certainly anybody that wants to go down into more detail and learn more about it, happy to do that.
Well, a little plug for our upcoming event. That was a good segue. Come meet Darren. I would say that his in our clinical rotations from the very first time. So this is our third event, Future of Dental Hygiene, and man, I'm telling you what, people came to him like a magnet. I mean, the interest in this. So the difference here is that on the second day, when we have the clinical rotations, you can see a brand new office that has fully integrated this across all systems. So that's kind of an added bonus to that. So March 31st, April 1st, here in Lexington, oralsystemicmastery.com has all the information on the conference. And that is the contact information for Darren and for Ken, dentalozonewater.com. That's my contact information. You want to take a picture of that?
Yeah, I just noticed there's a misspelling in the domain. It's Biosure NA, no U before the NA.
Oh,
Ken's is right. Mine's wrong. But that's
okay. My bad.
Can I mention two other things real quick, Tom?
Absolutely.
So, we didn't mention laundry. I know many practices use ozone and use laundry, have their own laundry. Ozone's an excellent added addition to laundry. So you can eliminate the use of Clorox or chlorine bleach if you use one of our inline units for laundry, and get a much higher rate of oxidation and destruction of any kind of contaminants in it. You can also go to cold water washes. You can eliminate hot water if you want to. We recommend it. You can also mix and match lights and darks, which is a problem for some of you like me that got out of the laundry business, a number of years ago, because I like to mix and match lights and darks and ruin stuff. But to do that, you can extend the life of the fabrics and you can cut back on your detergent. So it's just especially in a healthcare environment, it's just an excellent solution. It's popular in hospitals. And the second thing is, as you look at our portfolio of products, we operate in multiple sectors. We're in food safety, agriculture, food service, and restaurants. We're running an operational test right now with Subway restaurants where they're using this to wash produce before they put it on the line. All Cheesecake Factory restaurants in the U.S. and outside of the U.S. even use this in their systems and their food preparation. So we're in a lot of different areas, but we constantly get asked, why aren't we in Target, or why aren't we in Amazon or QVC, et cetera? And the answer is very simple. We recognize and see dentists, hygienists, dental practices as the most trusted profession in society. And it's a fact that people trust their dental practitioners more than any other professional member of society. And that is the area we want to drive understanding and awareness of ozone. And so with that, we make available these products, to dental practices so that they can, if they want to buy them, at volume and discounts and resell them, they can do that. If they want to simply refer them to us, get credit for them, et cetera. And we know all dental practices are a little bit different in terms of, you know, selling retail products or anything like that. But what we find is that after a dentist starts using, or a hygienist starts using ozone, their patients want to start taking it home. And unfortunately, we see people, you know, sending patients home with jugs of ozonated water so that they can use it for the week or whenever. And of course, it's no good by the time they get home. It's you know, it's broken down. So yeah, I'd like for everybody to keep that in mind. So as we, you know, you start to socialize this, you know, understand that that is an option, that not only an option that's available, but it's something we actually prefer and promote.
Very good. Any more questions? No?
I actually just popped a link in the chat if anyone in Oz is looking for products. They don't get shipped overseas. If you're in the US, go to Darren, I guess. If you're here in Australia, I'll put you in touch with the right people. And for those of you that don't have tickets to, or haven't bought a seat at Tom and Tosh's wonderful oral systemic course at the end of March, please go. It's so much fun with like-minded people, and it's how dentistry should be done. It's really exciting. You guys are doing a great job.
Yeah, thank you. It's a fun group. Very good. Well, thank you everybody for showing up tonight, and we'll make the replay available to as many people as we can.
Very good. Thanks, everyone.
Thank you.
Thanks, everyone.
Night.